Hi, my name is Akram Hosseini. I'm a neurologist from Nottingham, and I'm going to talk about long-term consequences of COVID-19 on neurocognitive and mental health functions, a clinical and 7 Tesla MRI study. This is an international effort, and I'm going to talk about this study on behalf of the CNS SARS-CoV-2 Consortium. I've written the names of the funders and people who have been directly involved in this study. The consortium aims to study chronic neuropsychiatric sequelae of COVID-19, and more details of this study and consortium can be found in the paper that I've mentioned here, if people were interested. But in summary, for the phenomenology and description of psychiatric symptoms, we use SCAN, that is the Scheduled for Clinical Assessment in Neuropsychiatry. The SCAN is used to assess, measure, and classify the psychopathology and behavioral changes associated with major psychiatric disorders. The cognitive assessment battery is adapted to avoid language and cultural bias, and there are harmonized protocols for biosampling and imaging protocols through this consortium. We have agreed protocols for 7 Tesla MRI data acquisition with Pittsburgh that allows using our existing data, the control cohorts and the cohorts of patients with early onset Alzheimer's disease. But in general, the imaging protocols are structural scans for the sequences that 7 Tesla is known to be superior to 3 Tesla due to higher resolution. I'm going to show some pilot data from Nottingham that may be of interest to you. We can't draw a conclusion yet, but these are relevant to in post-COVID studies, in my opinion. This is an example of a patient with longitudinal follow-up studies, including cognitive and 7 Tesla MRI. He is a 46-year-old man who presented in April with delirium and seizure. His clinical details are found in the paper that I've mentioned here. And his initial MRI of the brain at 3 Tesla showed T2 and flare signal hyperintensities in the subcortex of the left lateral temporal lobe. 7 months after his full clinical recovery, 7 Tesla imaging shows persistent and well-demarcated lesions, and the higher resolution that is available at 7 Tesla allows more accurate characterization of the lesion. This is another patient, a 69-year-old man who was hospitalized with COVID-19 in April. 7 months after his clinical recovery, you can see white matter changes on the MRI at 7 Tesla. The image A is T1 weighted sequence that shows a few signal hypointensity that corresponds with the signal hyperintensity on flare sequence image B. On the assessment of susceptibility weighted images, image C, there is no increased susceptibility, and this excludes microbleeds or vasculature like veins. But on susceptibility mapping on image D, there is an increased magnetic susceptibility that could reflect ion accumulation or myelin loss. And that's the same patient showing flare and T1 MP2 range. And just wanted to show the MP2 range at 7 Tesla that is very useful for regional and global volume assessment of the brain. And that's really superior to 3 Tesla imaging. On this slide, you can see images from 4 other patients who were hospitalized with acute COVID 6 to 8 months prior to their 7 Tesla imaging scan. And they all show some white matter signal hyperintensity. The question is, are these lesions appeared after clinical recovery from COVID, or were they present at the time of acute COVID illness or even before COVID illness? And really, in an attempt to try to answer this question, this is the scan from, this is a 48-year-old man who had clinical MRI at 3 Tesla during his hospital admission in April. On image A, you don't see any apparent signal change on flare, but on image B, 7 months after his clinical recovery, you can see white matter signal changes on 7T MRI on flare images. Obviously, we can't draw a conclusion.
So thanks, Akram. I'm afraid we've run out of time, but you're showing some really detailed data. Can you just in one sentence, just, give a conclusion? I'm sorry again, but we do need to finish now.
No, not at all. So really, in conclusion, CNS SARS-CoV-2 Consortium aims to assess long-term consequences of COVID-19 through multicultural studies. We need to look for persistent or emergent neuropsychiatric symptoms, and also look at the neuroimaging correlates. Stay in touch strategy, high sampling and genotyping are important. And I think the presence of cerebral white matter lesion at 7 Tesla a few months after hospitalization should be looked at in a bit more details, and more studies are needed for clarification.
Thank you so much. And I'm sure our attendees can contact you and also read that paper you mentioned. So I just want to thank all of our speakers for some excellent talks, and everyone for listening. We've really seen that the research here in COVID is just beginning. And unfortunately, the cases are still mounting up, but we've had the story from neuropathology of people who've sadly died and people who are in hospital, to trying to tackle the issue of long COVID and lingering symptoms, bringing in immunology, work in rheumatology, but also the real need for deep phenotyping, biomarker work, and also clinical trials in the future. So I'd like to pass back on to Lucia, and thanks to everyone for listening, and on to the talk from Professor Alistair Compston.